Hi, welcome to the Age Management Show.
I'm Dr. Ali.
And I'm Dr. Sam. Today we are going to be talking to you about hormones and why you are your hormones or lack thereof. Dr. Ali, why don't you tell us what we mean by that? What does it mean that you are your hormones?
Well, I've been at this hormone thing for about 18 years. And the conclusion that I've come to is that you are your hormones or lack thereof. You, everything that you are, your appearance, your mind, your mood, your behavior, your feelings, everything that you are is controlled by your hormones or their lack. And that's why I would say you are your hormones or your lack thereof.
Okay, so why don't you tell us what are hormones and why are they so important?
Well, if you look at a person and you see, how does this body work, right? So we see that there's about 12 systems: digestive system, cardiac system, pulmonary system, lungs, right? Kidneys, all these sorts of different systems. And they're all controlled by two main systems. The first main system is the nervous system, which is an electrical system. So there's a brain, spinal cord, and nerves. And all of these are like electrical wires, and they control all your all your organs. So your heart beats, your stomach digests, your brain thinks, you talk, you listen. All of this is electrically controlled by brain, spinal cord, and nerves. And that's your nervous system. And then you have another system that controls us, right? Who decides whether we're going to be happy or sad, we're going to be fat or we're going to be thin, we're going to be full of energy or we're going to be tired, right? Our mind, our appearance, our mood, our metabolism, all of this is controlled by the endocrine system. And the endocrine system is composed of the glands and the chemicals that they produce, which are called hormones. Now, the glands, you may have heard of some of their names: pituitary in the brain, thyroid, adrenal glands above the kidneys, the ovaries in women, and testicles in men. And these glands produce hormones, which are chemicals that go all over the body, and they control all the functioning at the cellular level, right? So your metabolism is controlled by your hormones. Your mood is controlled. Your appearance is controlled. So hormones control all these levels.
That's why they're so important.
Exactly, because they control you. They run your body.
So what about when we are lacking, when you don't have enough hormones?
Well, there's a natural rise and fall in the level of hormones, right? And we have expressions for this because when you're a little child, you have low levels. You go through puberty and you have raging hormones. This is an expression that we have, right? Your hormone levels go up quite a bit, and you grow into an adult. You change development stages, right? In your 20s, you're at your peak. And everybody knows that 18-year-olds are the most hormonal level, right? Every military wants 18-year-olds. They don't want 40-year-olds, fighting in the army. They want 18-year-olds because 18-year-olds have the highest hormone levels. They have the highest energy. You can beat them, kill them, shoot them, do whatever you want, drop them out of planes, drop them out of trucks, blow them up, and they still just keep on going. Because
or they have fights with their parents and their siblings, hence the difficult teenagers that we see.
Right. They also have, in your 20s, you have those high hormone levels. So, young men tend to be very aggressive. And this is the aggression that people tap into or is a problem. Now, in your 30s, there's a slight decline. And you go, oh, he's matured. He's so much better than he used to be when he was in his 20s.
You're mellowing.
Right. He's mellowed, right? So that he's mature, he's an adult. So that level starts to decline a little bit. And there's that famous expression, it's all downhill after 40. And that's when your hormone levels really start to go down.
40 or 50? I thought it was 50.
Nope, it's all downhill after 40. In fact, there's a slight decline in your 30s. In your mid-30s, there's a slight decline. But the rapid decline starts after 40. And this is when you start to notice these problems that you never imagined before. I seem to get tired. I'm putting on weight and I can't seem to get rid of it. And you know, and all
Can't
these sorts of,
can't stay out at those late night parties
right,
anymore.
right, right. 20-year-old stays up all night, partying, studying, whatever. 30-year-old struggling a little bit. 40-year-old doesn't want to go out till the weekends, right?
Mm,
50-year-old doesn't want to go out. 60-year-old doesn't want to go out at all. So all of this is it's a reflection of your internal environment where your hormones are declining. So
mhm,
your 60s, 70s, 80s, your levels go down and your behavior changes, and we call that second childhood
mhm,
because you sort of regress to those child levels in terms of hormones and also in terms of behavior, in terms of energy, in terms of abilities to do things, and desires. All of these decline with that age. So it's all downhill after 40. And so this is, if you look at it, stand back and you look at it, you are your hormones or your lack thereof.
So
Now,
is it like a slight decline after 40 and then it's sort of really goes downhill after 50, or is it just steep right after 40?
well, this is where men and women tend to differ. For women, there's a slight decline, but once they hit menopause, there's a rapid decline. Over a year or two, there's that huge decline. And you'll see it. You'll see it in her appearance, in her well-being, in her moods, in her weight, and all sorts of things. And you'll see her, and the appearance changes, and you may see her in premenopause, and you'll see her postmenopause, and you go, "Oh, what happened to her?" You know, oh, she doesn't look the same, and that's menopause. But whereas in men, we also go through a form of menopause. We call it andropause, but it's a much gentler decline. So eventually, in your 50s or 60s, the men and women equal out, right? But they both seem to have aged equally and all that sort of thing. But there's a period in that 40s and 50s where the man seems to have aged a little bit better than she has, and it's because of this rapid fall in hormones that occurs with menopause. And
Mm-hmm,
this is normal. This is natural,
mm-hmm.
but it's not acceptable.
Right. And maybe that explains some of those difficult times that a lot of couples have in their 40s and 50s because of maybe that mismatch in hormonal levels where the man wants to and the woman is just like, no, thank you.
Well, that would also account for the midlife crisis that we see in men because they're still much more hormonally energetic and that sort of thing, whereas the woman has lost her hormonal drive and it affects her moods, her desires, and all those sorts of things. And so there is a slight mismatch at that time. But
Mm-hmm,
fortunately, if you get through it, on the other side, you're okay.
mm-hmm,
Or we can look at replacing these hormone deficiencies, and neither one of them has to suffer because you stay in your 30s.
mm-hmm. What's one of the more common things that you see, say, after, even in your mid 30s or 40s, let's say? What would be one of the more common hormonal problems
Well, the most common hormonal problem is probably a weight gain and a loss of energy. That
related to
related to aging, related to the decline in hormones. See,
thyroid?
when you hear aging, you should equate that to a decline in your hormone levels, right? Now,
Mm-hmm,
obviously, young people have hormonal issues as well, and we do deal with those, as well. But primarily, when you're talking about age management, we're looking at those difficult ages where there's that natural decline in hormone levels, and you start to feel that I'm just not as good as I used to be. My energy is just not there. I'm not as energetic. The desires are just not as there. They're not there. The battle of the bulge starts, right? Weight is just an issue. In your 20s, you can eat pizza and go to sleep and you never put on an ounce. And
right.
if you look at a pizza and you put on weight. So it's just that change in metabolism.
So thyroid is probably one of the more common hormones that starts to decline earlier, whereas a lot of the other ones, progesterone, estrogen, testosterone, tend to be more, for women anyways, menopausal related. Um,
Well,
Thyroid, I find, tends to be, it starts much earlier than the other ones.
I would agree with you. The thyroid is probably the most underdiagnosed condition. Low thyroid, hypothyroid is probably the
Mhm.
most underdiagnosed condition in medicine. And I know that sounds like a strong statement, but if you look at it, it starts for many, it starts after childbirth. Because for some women, they have their baby and they're able to lose their weight. And for some, after the second baby, it's just, you hear them and they go, well, I was able to shed my weight after the first baby, but after the second one, it just doesn't matter what I do. I just can't seem to lose the weight. And it's become such a struggle. And this is because your thyroid doesn't work as well. And so your metabolism is slowed down. So you're putting on weight. And it's very easily corrected. The sad part is it's not very easily diagnosed because doctors tend to miss that diagnosis.
Mhm.
Uh, Underdiagnosed, and because of the testing, the way the testing is done, so this becomes an issue, and this issue persists for some women. They continue, and then they go through perimenopause and start putting on weight,
Mhm.
and or so even with the 2 kids or 3 kids or whatever, it's not an issue. The weight doesn't become an issue, but thyroid becomes an issue later in life. But essentially, as we age, all our hormone levels go down, and you then become a reflection of your lower hormone levels. And that's what I mean by you are your hormones or lack thereof.
Mhm.
Dr.
Makes
Sam,
sense.
would you like to talk about a case so that maybe we can see, uh, maybe illustrate what
Sure.
a typical case looks like, and then we can go back to these points?
Sure. I mean, both of us have lots of similar cases, I'm sure, and especially where it relates to thyroid. I can think of several, but I'll tell you of one particular patient that I have, and this probably reflects for, I'm sure a lot of people can relate to it. So an average 35-year-old woman who's in my practice. People are starting to have kids later. They start their families a little bit later in life once they're settled with their work and careers and whatnot. So she's 35, trying to get pregnant, but she has very irregular periods. She has had some weight gain in the last few years. Her energy is low because there have been some family stresses and work-related stresses, and she just doesn't have the energy to get up and exercise. She finds she's losing some hair. Her mood is usually low, and she tends to be more constipated. And she's trying to get pregnant. So initially, when she had very few symptoms, we did a test called TSH, thyroid stimulating hormone, which is generally used as a screening test. And it had been coming back pretty much normal. And and then slowly over a couple of years, the TSH started rising, indicating that her thyroid hormone levels were low. So she was started on levothyroxine, which is T4, and which is the standard kind of treatment that is done if you go to an endocrinologist or any family doctor. And she started taking levothyroxine, and she didn't feel any better, and so the dosage was increased, and she still didn't feel better, so they gave her higher and higher doses, and nothing seemed to be making a difference. They checked her T4 levels, so a test called free T4, and it looked like it was okay. The TSH was looking better, but she didn't feel any better. She was still having all those symptoms until we decided to check her T3. So T3 is the active hormone, thyroid hormone, which T4 is converted from T4 to T3, and then that is what is active at the tissue level, at the cellular level. So her T3 was quite low, and
Even though her TSH was normal.
even though her TSH was normal, and she was on Probably I would say one of the highest doses of levothyroxine that I've seen. Um, and we're talking minute quantities, but still it was high. So we decided to start her on a combination of T3 and T4, a natural combination. So it was compounded hormones, and she soon started to have changes in her symptoms. Her bowels started to get a little bit easier. Her energy started to come back. The mood started to lift. She was able to, make some changes to her lifestyle. So started exercising a little bit, but her weight, decreased, not in proportion to her exercise necessarily, but it just seemed to start shedding. Her periods started to normalize. And when we tested her blood tests, again, her levels, T3 looked better, her T4 and TSH were fine. And slowly she got to a level where she's feeling so much better. She feels like she has her life back, because she was almost at the point of quitting her job and going on stress leave or disability leave. And now she's working. She's feels wonderful, and energy is good. Her hair is better. Her skin is better. Her nails aren't breaking. They're not brittle anymore. She goes to the gym. She's eating well. Periods are regular, and she's still trying to get pregnant, but she's not there yet. But she probably will. She may have. Yeah, she may have other hormone imbalances, so she may need a little bit of something else to help in that department. But she's definitely way better than where she was.
Well, see, sometimes you have age-related declines in hormone levels, and sometimes in a younger person, you may have other reasons for it. It may be genetic, it may be stress, because all of these can reduce your hormone levels, and it acts as if you have a decline in the hormone levels, either age-related or whatever, but it's a decline. And there's two ways to diagnose a decline. One is obviously you do a blood test and it shows that the levels are low. The other way is the old time-tested way, which is to ask your patient. And the patients will have particular symptoms that match particular hormone deficiencies. So since we've been talking about thyroid, it's a very good example. So she was losing hair, her skin was dry, she was constipated, her energy was low, she wasn't losing weight. All of these things are classic low thyroid, right? And in fact, most physicians ignore it and don't even check for thyroid levels when you hear some of these symptoms.
Well, even things like depression. When a patient comes with depression, most physicians don't automatically test thyroid or even irregular periods or anything. Thyroid doesn't come up on the radar.
Well, it's not just thyroid. When you look at depression, which we'll be talking about on a different show, it involves other hormones, your sex hormones, estrogen, progesterone, and all of these are involved as well, and testosterone. But if you're looking at, but thyroid can affect concentration, it can affect mood. And so, but when you look at something simple like constipation, for example. Now, constipation isn't usually life-threatening, but constipation is life-altering. It's irritating, it's annoying, and people look for a solution. And usually the solution is drink more water, start exercising, go for walks and stuff, and increase your intake of fiber.
Yeah.
But, and you go to the physician and they'll tell you that, or you can ask your grandma and they'll tell you the same thing, right? But what you should be looking at is you should be looking at your thyroid levels. And once you look at low thyroid is classically reflected as constipation, but it's not classically checked for, right? So these little home remedies of increasing fiber and increasing water, and they do help some people. It's not that those things are silly. To the contrary, those are the first steps. That is what you should do. But then if that's not working, or if you're having other issues like weight and hair loss and all these other symptoms, then you should definitely evaluate thyroid levels. Then comes the next big thing, thyroid levels. Well, so we should do a thyroid test. Well, there's a dozen thyroid tests, and this is a huge area of debate right now in medicine, in endocrinology, in general medicine. what thyroid test? The classic test that's been used is TSH, thyroid stimulating hormone. And this is where the pituitary gland tells the thyroid gland to make more thyroid hormone, to make more T4. So everybody checks TSH, and you come back from the doctor and your spouse says, so what did the doctor say? Says, oh, check my thyroid and everything's fine. Well, not necessarily, because TSH doesn't always correlate with actually what are your thyroid levels. Mm-hmm. And your thyroid levels are seen by looking at free T3 and free T4. And this is also another topic that we'll get into in detail on another talk. But free T3 really correlates well with the symptoms. TSH doesn't always correlate well with the symptoms.
Mm-hmm, absolutely.
Even though it's the classic sign, the classic test that's done, it doesn't always correlate, but free T3 does.
It's actually the classic test that's done, and specialists discourage us from testing free T3, especially. Free T4 right. We don't do unless we're told that they are on some kind of thyroid medication. And free T3, forget about it.
Right. So hence the big debate, because many practitioners feel that free T3 correlates well with thyroid function, and that's what should be looked at in addition to TSH. And mm-hmm. But TSH, for example, I look at TSH as a traditional item, not as a necessary test. And so when you're trying to diagnose these conditions, it's not just, so what's the problem? You should look at the actual, what is going on, what is the cause, right? Which hormone is involved, what is the right test for it. Mm-hmm. And now you've got a result that shows that your thyroid is low. You're seeing the symptoms are low, and you're seeing that the blood tests are low. So now you have to replace it. So now even that is an area of contention, right? It's an area of debate. Should we give just T4, which has been the traditional medication that's been given? Mm-hmm. Well, the problem with just giving T4 is that some people, particularly with age, can't make T3, the active form. Right? It's like having a credit card with a huge limit on it, and that's all T4, but you can't spend it because you can't convert that into cash. So T3 you can think of as cash, and T4 you can think of as a debit card or a check or something else that you can't directly buy with. You need to get cash. Then you have to convert this into the T3 to be able to use it. Mm-hmm. And the key to unlocking the cash is an enzyme called 5'-deiodinase, right? And this is one that cuts one iodine atom off of T4 and makes it T3 with 3 iodine atoms. And this active form is what you need. But there's a debate on whether you should give T3 or T3 and T4 or just T4. And it depends on the age of the patient, depends on the patient. Mm-hmm. But, so this is something that, is also being argued. But we feel that T3 is not contrary and not contradictory to the patient's best interest.
Yeah, in certain situations, in certain patients, they do need both. I mean, if someone has enough of their enzyme to convert T4 to T3, then fine, they may be able to get away with just T4.
But you see in other people. But as you hit that big 4-0, and not only do your hormone levels go down, but your enzyme levels go down.
Right.
And above 40, I find that they benefit most from a combination of T3 and T4. Mm-hmm. Even though T3 is very short acting, but still giving that combination gives you better results than just throwing a bunch of T4 at them and hoping that they're going to make some T3.
Well, yeah. And in the case of my patient, she wasn't even in her 40s. She was still 35, and she needed both. Because your thyroid gland is very sensitive to stress and other things. So that's why some younger people, their thyroid hormone declines, their thyroid hormone function declines earlier, before their 40s. And they need both. They need... Mm-hmm.
And life is more stressful nowadays. So stress is going on to younger children. And so we are seeing conditions in younger people that we weren't seeing earlier on. Mm-hmm. And pregnancy is a huge stress. And so you'll see that also affects thyroid, which in turn has weight issues in younger women.
Very common postpartum, even intrapartum to see thyroid fluctuations.
Right.
Yeah. But so many endocrinologists, so many specialists are discouraging the use of T3, even to test T3. It is being discouraged, and I know a lot of my patients that I have put on a combination will be told by the endocrinologist that, oh no, that's dangerous for you, you need to come off of it. Meanwhile, the patient says, I'm feeling great. I feel so much better, doctor. Why? Why is he taking me off of this?
Well,
Then I have to undo all that.
Well, let's look at it. It's not that the endocrinologist doesn't have the patient's best interest at heart.
Mm-hmm.
They do. And that's the reason why they're being extra cautious.
Mm-hmm.
Now, medicine still remains a science and an art.
Mm-hmm.
And the science part is that if you have a deficiency and you replace the hormone, the patient feels better. Now, then you look at the downside. Well, there's a theoretical piece that if you give too much T3, there could be potential bone loss, and there could be an initiation of osteoporosis in a young woman. And this is a theoretical thing that has been looked at and thought about, and is pushed as an argument against T3. But there's that fine line that we have to decide what is in the patient's best interest, right? How much T3 is dangerous? Well, that level isn't really known. So if you give low levels and you stay within physiological levels of T3, you should be fine. Mm-hmm. Obviously, go to high levels of any hormone, excessive hormones, right, which we call supraphysiologic, that is dangerous, right? Because the body is a marvel of engineering. It stays within ranges. And if you keep your hormones within ranges, within these natural ranges, you'll be fine. You'll feel great. Mm-hmm. So if it's too low, you have a problem. If it's too high, you have a problem. But there are these optimal ranges, and we define those as 30-year-olds, where you're not so high energy or so high levels that you're out of control, or you're not like a 60-year-old where your just levels are too low. So we look for these optimal levels, and this is what we use as a guide to what you should be getting and what we should be giving to you.
So we're aiming to get to the levels, basically to that 30-year-old level,
right?
For whether it's for thyroid or for other hormones or anything.
Yes, and you see, the body is so amazing that it knows when it feels good, right? So, for example, we look at temperature, right? If the room is really cold, we start going, wow, it's kind of chilly in here. Can somebody turn on some heat or give me a jacket or a blanket or something? If it's too hot, wow, it's really hot in here. Mm-hmm. But if it's comfortable, you don't say anything, right? You don't even think about temperature because you're comfortable, right? You're in that happy zone. You're in that zone. And this is similar to what you'll find with hormones, right? If your weight is optimal, everything is good, the chances are your thyroid levels are perfect, right? Your weight is good, you're not losing hair, your skin isn't dry, your nails aren't brittle, so your symptoms of low thyroid are not there, right? So when you replace it, and people start to feel better, their weight starts to come off, they start to respond to exercise, they start to be more energetic, you wake up fresh, right? These are the benefits of thyroid. When you start to have these and you look at the blood test levels, so you make sure that they're not out of those ranges. So now you're giving them a safe, efficient level of hormones.
Right. And we have, the reference ranges that are provided by the labs sometimes are very wide and sometimes are very narrow. There's an optimal point in all of those because obviously these are averages that we've taken from the population. And some people get very nervous when their patient starts to get on the higher end of the range, but honestly, you have to correlate that with how the patient is feeling. So if they're still within the range and they're not having side effects, bad side effects, of having too much thyroid hormone, palpitations, tremor, those sorts of things, then chances are that that is optimal for them. Some of the ranges, though, are ridiculously wide, right? And as long as the patient is anywhere in that, they could be on this end or this end, the doctor calls them normal. And yet the patient doesn't feel normal. Mm-hmm.
That's the problem, because they aren't normal, because you could be low normal, but you aren't optimal. So with age management, our aim is to optimize you, to have optimal levels of hormones, optimal levels of nutritional supplements, so that you are optimized, so you can live life at the best, at the maximum, regardless of age.
Mm-hmm.
And that's how we manage age, so that you are optimized regardless of age.
So what would you say, what are 3 tips you can give our listeners?
Well, the first one is you should have your hormone levels checked, right? By somebody that understands all these nuances, all these subtle things about hormone, right? Your general doctor may not have the knowledge and depth of knowledge to be able to handle your hormones. So you should look for an age management specialist to really check all your hormones, right? Because if you miss some of them, well, that could be critical as well. So check all your hormones, number 1. Number 2, if your levels are suboptimal and you're having symptoms and the blood levels are low, then you should have replacement. You should have hormone replacement to optimize you, because this allows you to be optimal so that you can live optimally, so that you can follow optimal lifestyle. For example, this young lady wasn't able to exercise and, to incorporate that into her lifestyle because she didn't have the energy, right? And most doctors will tell you, oh, well, you need to lose weight and you need to get out there and exercise.
Mm-hmm.
But they don't help you on how to do it, right? Because you just don't feel like it. Well, if we give you a little bit of hormone and we give you some nutritional supplements, all of a sudden you'll feel like it. I have most days I need to swim. I really need to go and jump in the pool, and I need to go and swim, and if I don't do it, I don't feel right, because that's just my energy level. And with optimized hormones, I feel that I need to exercise. And for many people, it's like, oh, yeah, I wish I felt like that. Well, it's not so hard to feel like that, right? When you see little children running around, you're at a party or somewhere and somebody or a restaurant, and you have these little kid and they just can't hold them down. The kid is just full of energy and they just can't hold them down. And that's because that kid's hormone levels are just making them burst with energy and run around, and they can't help it. But we don't want to be at that level, but we want to have a level where we feel like actually going and doing something active, because we know all the benefits of exercise, all about blood circulation and, maintaining your organs and your tissues and all the good benefits that come with exercise. But by the time you're done with work, you just don't feel like it at the end of the day, but you should feel like it. And we can help you with that.
So testing your hormones, getting the proper testing done is number 1. And replacing them to a 30-year-old level, let's say, a youthful level.
Yes.
Mm-hmm.
And the third one is that you should use bioidentical hormones. Now, this is another huge bone of contention in the medical world, the term bioidentical. So bioidentical, it's a simple definition. It means that the atomic structure, the molecular structure of the hormone should be the same as the one that your body makes, right? And there are different versions that are available in the market. There's some that are from animals that are being prescribed for humans. There are some that are human ones that are copies of human ones. And the ones that are copies of synthetic ones, but the ones that are copies of human hormones are termed bioidentical. And it's not just a marketing term. It's actually a real physical difference, because the atoms and the alignment of the atoms, the structure of the atoms and the molecule itself are identical to the one your body makes. And the body is very specific in terms of what it'll accept, right? Even one atom difference and the body gets upset. For example, You will drink water all day long, H2O, no problem. But you will not drink H2O2. It's just one atom difference, one oxygen atom.
Mm-hmm.
And you may use it to bleach your hair, but you're not going to be sipping on it all day long because it's hydrogen peroxide. And it's one atom, one gentle oxygen atom.
One extra oxygen atom.
Extra oxygen, right? You're breathing oxygen 24 hours a day. But yet, tag it to that water molecule, it becomes poisonous for you. So all this nonsense that, the molecules don't matter, and it's whether it's synthetic or it's an equine, it's an animal hormone or whatever, is not a big deal. It is a big deal. That's just a big lie. And the term bioidentical is important. It is critical because that's how you avoid side effects. And studies have shown that non-bioidentical hormones can increase the risk of heart disease, strokes, and cancer in people that take them. And this has been shown in menopausal women who were taking hormones for those menopausal symptoms. So it's very critical that you use bioidentical hormones to replace your deficiencies.
Okay, so those are three good tips. Get your hormones checked, replace them to levels of a youthful 30-year-old so that you can maintain your youthful mind and body, and use molecules that are identical to what your body makes, bioidentical.
And that brings us full circle to you are your hormones or lack thereof.
Okay, so you deserve to have the best health possible, and age management medicine will help you lead a happier, healthier, more energetic life. And you need to be informed about age management medicine so that you can make the best health decisions for yourself.
Thank you for watching our age management show. I'm Dr. Ali.
And I'm Dr. Sam. Remember, you are your hormones or the lack thereof. Stay tuned for more exciting information on age management that will change your life. Follow us on social media and have a great day.
See you soon.